How do you know when you're starting to age? Some people judge by their appearance, like the appearance of wrinkles on their face. Yet, some friends argue that as long as they possess a youthful heart, they don't consider themselves old. However, others worry that despite having a youthful heart, the inconsistency between their inner youth and their outward appearance creates a sense of disharmony. Therefore, facial wrinkles should be taken seriously and treated properly to maintain healthy skin. Today, let's discuss how to prevent and reduce facial wrinkles. Why wrinkles appear on the face. First, let's briefly discuss why wrinkles appear on the face. This involves understanding the three layers of the skin. The top layer is the epidermis, which contains various cells but no blood vessels. Its main function is to protect the underlying structures from environmental damage and prevent moisture loss. Once its function diminishes, the skin becomes dry, making the structures beneath it more prone to aging and damage. The middle layer is the dermis, containing tiny blood vessels and complex structures like hair follicles and sweat glands. However, its richness in collagen and elastic fibers, among other components, forms a resilient, elastic network that provides skin with its elasticity and toughness. Once these structures are damaged and age, wrinkles are more likely to form. The bottom layer is the subcutaneous tissue, primarily composed of fat cells, providing cushioning and support for the skin and storing energy. A lack of subcutaneous fat can lead to skin sagging, indirectly promoting the appearance of wrinkles. What are the common causes of wrinkles? Any adverse effects on these three skin layers can lead to facial wrinkles. What specific reasons contribute to this? The first reason is normal aging. Everything in the human body degenerates, metabolism slows down, and the body's reserves are gradually depleted. Collagen and elastin progressively diminish, and the rate of new cell growth slows. I often encounter elderly people in their 80s and 90s whose skin is as thin as paper. If they fracture their wrists and need traction for realignment, the skin might tear during the process. The second reason is excessive ultraviolet radiation. It increases oxidative stress and free radicals in the skin, damaging the epidermis, leading to dryness and peeling. It also damages the collagen fibers in the dermis and inhibits the skin cell's self-repair abilities. However, avoiding sunlight and UV rays entirely is not advisable since the body needs UV radiation to synthesize vitamin D. We also need near-infrared light from the sun to activate mitochondrial melatonin production, combating oxidative stress. Thus, the safest and simplest method is to minimize direct sunlight exposure by choosing outdoor activities during less intense sunlight in the early morning or late afternoon. The third reason is glycation damage to the skin, a major intrinsic factor in skin aging. This refers to the accumulation of advanced glycation end products, AGEs, in the skin, amplified by external factors like UV radiation, causing wrinkles, loss of elasticity, dullness, and other skin issues. AGEs can be ingested through food and tobacco or produced by the body itself. High-temperature cooked foods, such as grilled, roasted, or fried meats, fries, and fish, as well as toasted bread, biscuits, cakes with darker colors indicating higher AGE content, and processed meats like ham, bacon, sausages, dried or candied fruits treated with drying or sugaring, can all produce significant amounts of AGEs. High blood sugar levels or inflammation can also slowly generate and accumulate AGEs. The fourth reason is inadequate skin hydration, with the epidermis unable to effectively lock in moisture. Living in dry, cold, windy environments, not drinking enough water, over-cleansing the skin, using inappropriate bathing products, and not repairing the damage can all adversely affect the structures beneath the epidermis. The fifth reason is excessive smiling or long-term stress, anger, or restraint. Because facial collagen is repeatedly folded and stretched, wrinkles form. If you try to reduce facial wrinkles by forcibly maintaining a neutral expression, avoiding smiles, that in itself is a joke. Many other factors indirectly contribute to the formation of skin wrinkles, including genetics, skin color, long-term excessive drinking, prolonged exposure to blue light from phones and computers, irregular sleep patterns, significant psychological stress, and a lack of essential nutrients. How to prevent and reduce facial wrinkles. Once you understand the common causes of skin wrinkles, we can develop targeted prevention and treatment measures. Except for race, genetics, and skin color which we cannot change, and aging which we cannot reverse, we can adjust other factors. Firstly, lifestyle and dietary habits are crucial. Avoid smoking and drinking, eat nutritionally rich natural foods, minimize processed foods, stay hydrated, avoid staying up late, exercise moderately, learn to manage stress, connect with nature, spend time with family and friends, and maintain a positive and joyful mindset. You can minimize the accumulation of ages in the body and allow the skin to obtain sufficient collagen, antioxidants, and other nutrients to combat damage. These are easy tasks for everyone, risk-free, and do not require extra costs. They are powerful weapons against aging. Besides, let's analyze some other methods together. The first is facial moisturizers. A cross-sectional study of Chinese and British women found that women who regularly use facial moisturizers appear about 2 years younger than their peers who do not. Clearly, this refers to looking younger, not biologically being younger. Moisturizers can indeed quickly improve the appearance of dry skin and reduce some of the fine lines. However, this method does not address the decisive causes of skin wrinkles. Looking at the market, most skincare formulas are moisturizers mixed with so-called active ingredients to increase product prices. They are then renamed anti-aging creams. However, these products are more of a placebo effect, lacking rigorous scientific support for anti-aging claims. Considering the common causes of skin wrinkles, excessive UV radiation stands out. Our faces are exposed to more intense and frequent UV radiation than other body parts. From this perspective, I believe sunscreen, along with hats and protective clothing, is most valuable. For those concerned about beauty, if you plan to be in the sun, try using a moisturizer with sunscreen protection, opting for products with an SPF of 15 or higher. They can help prevent further aging of the facial skin but cannot reverse existing photo damage. For me, I don't use these products. I enjoy the sunshine, hence my face is full of fine lines. Since sunscreens and moisturizers cannot reverse photo damage and improve fine lines fundamentally, you might wonder if there are other products that can. Next, we'll discuss topical retinoids. Pharmacologically, retinoids, also known as tretinoin or retinoic acid, are derivatives of vitamin A, mainly used to treat acne and some hyperkeratotic skin diseases. However, many clinical and basic research studies have confirmed that retinoids can promote the synthesis of skin collagen, offering anti-aging benefits, improving fine lines, fading pigmentation, and enhancing overall skin quality. But they usually require daily use for over 3 months to see significant effects. To date, retinoids have evolved to the 4th generation. However, their mechanism of action, forcing continuous skin renewal, also leads to side effects. Many users experience skin redness, tingling, burning, itching, and peeling. Moreover, particularly oral retinoids increase the risk of birth defects. Therefore, women planning to conceive should avoid these drugs for at least 3 months. If you still decide to use retinoids, first, please do so under the guidance of a dermatologist. Second, start with a low concentration of 0.025% and low frequency, gradually increasing the concentration and frequency of use to minimize skin irritation. Third, if your skin tolerance is poor, consider milder vitamin A derivatives like retinol and retinaldehyde. Fourth, remember to include moisturizing skincare products during use. Retinol esters turn into retinol, which then becomes retinaldehyde, and finally changes into retinoic acid, also known as a retinoid. In terms of safety, retinol esters are the safest, followed by retinol, then retinaldehyde, and retinoic acid is the least safe. However, when it comes to how effective they are, it's the opposite. Retinol esters are the least effective, and retinoic acid is the most effective. For those who cannot tolerate retinoids or choose not to use them, topical niacinamide is another option. It is a derivative of vitamin B3, also known as niacin. A study published in 2004 explored whether topical niacinamide could improve signs of skin aging. This randomized, double-blind, placebo-controlled clinical trial involved 50 Caucasian women over 12 weeks. Each participant applied an active formula containing 5% niacinamide to one side of her face and a placebo moisturizer to the other side. Neither the researchers nor the participants knew which side received the niacinamide moisturizer. The study concluded that topical niacinamide reduced fine lines and wrinkles, pigmentation spots, and improved skin elasticity. A paper published in 2021 preliminarily explored the mechanisms by which niacinamide controls skin aging. It suggests that niacinamide helps reduce local inflammation in the skin, increases collagen synthesis in the dermis, and enhances the skin's barrier function and structural stability by increasing lipid component synthesis. It seems to be effective, and many studies have confirmed its safety. However, you still need to be cautious as using niacinamide can cause skin redness, itching, or burning. So, please use it under professional guidance to avoid unnecessary health risks. The third method is topical vitamin C, but this is somewhat controversial. Although the majority of studies acknowledge the importance of vitamin C for the skin, such as through this study, we know skin fibroblasts absolutely depend on vitamin C to synthesize collagen as well as regulate the balance of collagen and elastin in the dermis. Skin keratinocytes can accumulate high concentrations of vitamin C, which, combined with vitamin E, provides protection against UV radiation. Thus, vitamin C plays a crucial role in maintaining skin elasticity and antioxidation. However, this study also considers it challenging to deliver vitamin C to skin cells through topical application, as vitamin C is water-soluble. But special processing techniques, forming liposomal vitamin C, may help overcome the difficulty of vitamin C absorption by the skin. A study published in 2021 evaluated the anti-wrinkle effects of lipophilic vitamin C. They conducted a randomized double-blind placebo-controlled trial with 23 women, finding that topical application of lipophilic vitamin C cream could reduce wrinkles around the eye area caused by skin aging. Of course, if you wish to let your skin absorb vitamin C from plant-based masks, it's an option. However, due to the low concentration of topical vitamin C and its susceptibility to oxidation, it may not achieve the desired effect. Lastly, let's briefly discuss invasive treatments for wrinkle removal, such as botulinum toxin injections, soft tissue fillers, chemical peels, and laser resurfacing. Compared to previous methods, these approaches seem faster in removing wrinkles. However, the greater the expected benefit, the higher the risk you'll need to face. There are many successful cases of cosmetic surgery, but failures are also common. For instance, complications like subcutaneous hematoma, severe muscle spasms, soft tissue infections, vascular embolism, filler displacement, scarring, hair loss, and facial nerve damage are among the many potential harms you might not have imagined. Thus, you're taking a huge risk without guaranteed benefits. More concerning is that in many countries and regions, individuals performing botulinum toxin injections are not professionals. Many have only undergone brief training before starting their practice. Their risk awareness and comprehensive knowledge are not as profound as clinical doctors and nurses, nor are they fully equipped to handle emergencies. This means patients undergoing treatment face greater risks. Lastly, regardless of the country or region, if you consider using invasive treatments to remove wrinkles, don't be swayed by advertisements. Carefully choose authoritative cosmetic medical institutions for treatment.